Welcome to the Health Fix podcast, where health junkies get their weekly fix of tips, tools, and techniques to have limitless energy, sharp minds, and fit physiques for life. The Health Fix podcast is sponsored by Optimizers. So let's talk a little bit about their product, Magnesium Breakthrough. One of the best things you can do to improve your health is get at least 7 hours of quality sleep every single night. I know, it's hard to get that much sleep. Your mind keeps you awake, you're thinking about things, you get uncomfortable, you wake up early, and you just can't fall asleep again. There are hundreds of reasons why you can't get 7 hours of quality sleep every single night, and I've probably at least told you 100. But hey, listen, it's super important because your body heals itself when you sleep. And if you're not getting enough quality sleep, you're increasing your risk of disease and making it harder to lose weight. Yes, weight. Would you like to know an easy way to get more quality sleep every night? Make sure you're getting enough magnesium. Believe it or not, around 75% of people don't have enough of it, which helps explain why so many people have sleep problems. Unfortunately, most magnesium supplements are not full spectrum, so they won't fix your magnesium deficiency or help you sleep better. There are actually 7 unique forms of magnesium, and you must get all of them if you want to experience its calming, sleep-enhancing effects. That's why I recommend Magnesium Breakthrough by Optimizers. Simply take 2 capsules before you go to bed, and you will be amazed by how much better you sleep and how much more rested you feel when you wake up. For an exclusive offer for my listeners of the Health Fix podcast, you guys want to go over to www.magbreakthrough.com/healthfix. And you can save up to 42%. Yes, that's right, 42% savings on Magnesium Breakthrough when you go to www.magbreakthrough.com/healthfix. Hey Health Junkies, on this episode of the Health Fix podcast, I'm interviewing Dr. Gil Kajiki. He is a certified functional medicine practitioner and a chiropractor. And what's cool about him is that he is the Hashimoto's thyroiditis detective. Kind of cool. And here's the thing. He gets to the root of what's going on. And how does he do it? Well, he has some experience. His wife was quite ill and even hospitalized. After multiple doctor's visits, B12 shots, medication, nothing was helping her. She was fatigued, she was worn out. And finally he was like, that's it, let's dive in and figure out what's going on. And turns out she had some triggers that were keeping her sick. And to this day, she is healthy. She's not on any thyroid medication whatsoever. And it's what helped Dr. Kajiki create the protocol that he has now, the Kajiki protocol for Hashimoto's thyroiditis patients. So guys, this is a great podcast. He gives some really good nuggets here. I'm excited to interview him. So let's get into the podcast. Hey Health Junkies, I have Dr. Gil Kajiki on, and as I mentioned in the intro, we are talking all about Hashimoto's today, and Hashimoto's thyroiditis is quite a deal, an ordeal, if you will, and I'm going to have Dr. Gil talk about his ordeal with his wife and how he came to discover his Kajiki protocol and all of the things that they are doing over there at the Valley Thyroid Institute. So, Dr. Kajiki, welcome to the Health Fix podcast.
Thank you so much for having me on.
So, you know, we're going to be talking about your book because I think that the title of it really kind of characterizes what happens for a lot of folks with Hashimoto's. The whole sick, tired, untreated, and abandoned. I mean, kind of sums up how a lot of people are feeling by the conventional medical world when it comes to thyroids in general. And I'm seeing you wrote a book on it, so you obviously nailed it right to the T.
Yeah. I've been doing this for so long, I decided that I wasn't going to tiptoe around this anymore. I was just going to get directly to the point to these people who are frustrated and untreated and feel like they're abandoned and go, here's the reason why. This is why this is going on. And I decided, I'm just going to be a little controversial and just tell it like it is in my title.
It makes perfect sense. It makes perfect sense. And I think a lot of people are going to identify with it and with this podcast too, because I, as a naturopath, will have folks coming into me and going, doc, I went to my other doc, all my labs, are coming up normal. And I think I have this thing called Hashimoto's, but no one's ever tested my antibodies. Have you found that to be like 9 times out of 10, no one's looked past even the basics when folks come in?
Yeah, and that's the early stages.
Mm-hmm.
People will typically seek out other endocrinologists or other GPs or MDs or naturopaths or acupuncturists. And my typical patient, though, is they call me last.
Okay.
They say, I've got Hashimoto's. I'm taking my medication. I've been doing everything my doctor's saying. Nothing's working. I don't know what to do now. I kind of found you on the internet. So a lot of them do know that they have it, and just nothing they're doing is working.
Gotcha. Yeah, having been in the game for quite some time myself, I know that, finding a medication that works can be extremely tricky, but ultimately it's that lifestyle stuff on the underlying that makes more of a difference, because a lot of people come to me, going, all right, there's got to be some medication combo I haven't found yet, or some secret. Are you seeing the same kind of thing as well?
Yeah, I mean, we're dealing with people, right? And human beings. And as human beings, we want to do the easiest, cheapest, fastest, most convenient thing possible. And that's pop a pill. But when you have Hashimoto's, you can't do that. You have to manage the lifestyle. You have to manage your diet. You have to look at your adrenals. You have to look at your inflammation. You have to look at your hormone. There's so many things you have to do other than just pop a pill. I've never seen a change in medication or popping a pill make the difference between you going into remission and not.
Yep. I wholeheartedly agree. So interestingly enough, I was reading the story on your wife and looking at how you were describing, you thought it was Epstein-Barr. She was chronically fatigued. She ended up in the hospital. I mean, I will see folks that have had this same type of pattern as well. And Epstein-Barr seems to go a little bit hand in hand with the Hashimoto's conundrum. Can you explain a little bit of what you've seen and kind of your theories on what's going on there?
Yeah, I mean, I don't think there's any real legitimate research on why Epstein-Barr is so prevalent with Hashimoto's. I wish there was. There's just not.
Yeah.
I will tell you, statistically speaking, that 80% of my confirmed Hashimoto's patients have an active replicating Epstein-Barr infection. Mm-hmm. Why that is, don't know. There has been talk from other practitioners that this Epstein-Barr virus hides out in your thyroid gland and in your liver, and that when you get this autoimmunity, it reactivates, and this is what we see. I don't know why that is, but whenever somebody complains of these symptoms of Epstein-Barr, like this chronic fatigue, the flu-like symptoms, the brain fog, the body aches, I'm always suspecting there's an Epstein-Barr infection. And that's one of my main triggers that I go after, is these stealth infections that, you know what, I'm going to test for it. It's likely going to be positive. I may not go after it because there may be some other overwhelming triggers that I need to go after first. And I have a very, very effective Epstein-Barr protocol, very effective. However, what I found is if you don't address inflammation, if you don't address blood sugar instability, if you don't address food sensitivity, you don't address digestion first, my protocol is not very effective.
I would agree with you. On that. So tell us a little bit about your protocol, because you're kind of hitting on some of the things that folks tend to let's put it this way, I'll call it much like nibble on. A little bit of the digestive stuff, a little bit of dabble, maybe it's more dabble, little inflammation, little here, little there, but not all put it together. So tell us a little bit about your protocol, how it all comes together, and what you're doing there at the Valley Thyroid Institute.
So the way my practice is patients have these set of symptoms, and every Hashimoto's patient is different. But what I know is every one of these Hashimoto's patients has either a Hashimoto's component and or a thyroid component, or something that I call triggers. And triggers are body dysfunctions that agitate the immune system, cause that immune system to attack that thyroid and get those thyroid symptoms. However, these same triggers are also body dysfunctions that very closely mimic a thyroid problem, but isn't a thyroid problem.
Interesting.
So these triggers, they look like a thyroid problem, they act like a thyroid problem, they feel like a thyroid problem, have the same symptoms as a thyroid problem, but it's not a thyroid problem, it's a trigger. And there are 9 very common triggers that I look for and treat. And this is where people make their mistake when they self-treat, is they dabble at these little triggers and they try to think that it's one.
Yep.
It's never one. It's always a combination. And these combinations, you have to find out what's the higher priority for you. So you may have 6 of these triggers that I'm going to mention, but one of them might be 50% responsible for what's going on. And if you read about hormones and you think hormone is the trigger, but it's only responsible for 10% of how you're feeling, you will have a failed case.
Yep.
So I look for anemia. And there's more than just iron anemia. There's B12, B6, B1, folic acid, nomochromic, hypochromic. I mean, there's multiple kinds of anemia other than iron.
Mm-hmm. True.
Blood sugar instability, adrenal gland dysfunction, hormone imbalance, inflammation, gastrointestinal problems, food sensitivities, chemical sensitivities, and hidden infections. And those are just the most common 9. I mean, I could throw emotional stress in there and that will override all of them.
Yeah. Yes, it will. Yes, it will, for sure.
So these triggers are what's responsible for either their symptoms that they think are thyroid, but they're not, or these triggers are causing these individual symptoms, agitating the immune system, causing it to attack the thyroid, or they're giving you these symptoms alone, which is why it's so difficult to manage a Hashimoto's case on your own, because you don't know which of the triggers you have, you don't know how to prioritize the triggers, and you don't know what kind of protocols to do for these triggers.
Mm-hmm. Mm-hmm.
And in a complex case like my wife's, you've got a thyroid issue, you've got a Hashimoto's issue, and you have all these triggers. So you've got multiple things going on at the same time, and you can't resolve it with Synthroid.
Yeah. Or any compounded versions of different things.
Yeah. You can't do it with a natural, you can't do it with NatureThyroid or Armor. You have to address the root cause, which are identifying the triggers, start resolving the triggers through natural protocols, which will then stop the autoimmune attack on the thyroid. And then you know if it's really thyroid or not.
I like that. I like that. Take all the other things away and then see what hammers out. Because oftentimes I would agree with you. I've worked on digestive system or worked on sometimes mold, things of that nature in terms of chronic infection. And all of a sudden the thyroid normalizes and we have no antibodies.
Right.
And yeah, it's quite amazing how that can play out. Now, I think a lot of people are probably going like, okay, so when I work with you, Dr. Kajiki, how do you tell me what one's going to be the one we focus on? Is it based purely on labs and symptoms, or how do you know where to focus based on your protocols?
I always start with the patient symptom.
Mm-hmm.
So, because in their world, that's most important. Is
Sure.
like resolve my symptom. I don't care what my lab tests look like if I feel crappy. And I agree. So I want to know what's their symptom, which will help me figure out what kind of trigger do I want to test for. And then I can decide if I'm going to use blood, stool, saliva, dry urine, hair breath to find that trigger. So I use the patient symptom, the patient history, and the lab marker to determine what trigger I'm going after. And then based on what their symptoms are, I can prioritize that trigger saying, well, she's got insomnia, so maybe that's adrenal and blood sugar. Or she's got bloating and gas and constipation and diarrhea. Maybe that's gastrointestinal and inflammation. Maybe she's got brain fog and depression and anxiety. Maybe that really is thyroid, but maybe it's gut because of neurotransmitters or blood sugar instability. So I will prioritize the trigger based on their symptom and their lab markers that they have. And then I can create an effective protocol where I prioritize these things.
Makes sense. Makes sense. Now, I noticed on your YouTube video, a lot of people talking about weight, because it does seem to be what brings women in particular in to be like, what, my weight just keeps going up. Doc, I wish you had a pill for me.
Right.
What would you say in terms of triggers? Obviously a lot of us would think about blood sugar and things of that nature and hormones. And those seem to be the two ones along with the thyroid. But what have you also found that's a contributor to weight gain when the body's out of sorts?
Yeah, blood sugar, hormones, but I'll tell you the most common one probably inflammation.
Yeah.
It's inflammation. And the thing is, we don't know where that inflammation is coming from. It could be coming from insulin resistance. It could be coming from infections. It could be coming from food sensitivities. It could be coming from leaky gut, right? So we don't know where that inflammation is coming from. But what I'm concerned about is if they're showing symptoms of inflammation and my lab markers show inflammation, the first thing I'm going to do is I'm going to do anti-inflammatory protocols. I'm going to put out that fire, and then I'll worry about where it's coming from.
Nice. Okay. I'm getting a pattern here. Put out the fire, whatever the main fire is, just so folks have a little bit more of an idea. And then we're going after it from there. I like that. Now, in your book, I'm guessing you're kind of talking about what we're talking about here, those 9 triggers, things of that nature. Once someone goes into figuring out their main trigger and you've helped identify that, then will you tend to go and put fires out in the rest of the areas where they're showing inflammation, or where do you go to after that?
Yeah, well, typically I found that they may show 8 out of 9 of those triggers, but I go after what I feel are the main 3 that are causing most of their symptoms. And when you go after those main 3, a lot of those other triggers will start to calm down.
Nice.
Because unlike conventional medicine, we understand that the body works in conjunction. Everything's related to everything. So you can put out a fire and blood sugar stability will get better. Digestion will get better. Right? Adrenal function will get better. Like a lot of things get better just by handling the big things as opposed to the little things. So my philosophy, and some practitioners are different, but my philosophy is triggers are high priority. Okay. Deficiencies are important, but triggers are high priority. So I don't go after selenium deficiency and folic acid deficiency and iron deficiency, but I'll go after adrenal dysfunction. I'll go after gastrointestinal. And I found by getting the big guys taken care of, you will take care of a lot of the little ones, and a lot of those minor triggers will also get under control a lot better too. So you have to do a lot less work down the line.
It makes sense. I mean, it makes sense. A lot of people, it seems like they're starting at the bottom of the deficiency side of things with, well, let's get the selenium, magnesium, things of that nature. And yeah, you can throw all that at something, but if the inflammation is not taken care of, the blood sugar isn't managed, not much else is gonna shake out in that department. Now, in terms of your protocols and whatnot, how long is your protocol? What can folks expect if they join up with you? Because I see that you work with people pretty much all over the world and do a lot of virtual work. So tell us a little bit about the Kajiki protocol once folks get, the main triggers, those 3 kind of taken over. How long does this take? What time commitment do they have? What's going on there?
Right. Well, as you know, everybody heals at different rates, right? So people say, when am I going to feel better?
Yeah.
I don't know. I wish I did. I just don't know. Now, I will tell you that in my practice, I typically get a report back from the patients that say right around 6 to 8 weeks, they're feeling noticeably better.
Nice.
Noticeably better. Okay. Whatever that means to them, they're saying, yeah, I feel noticeably better. Sometimes it's 2 weeks. Sometimes it's 12 weeks. If you go to my YouTube channel, you'll see some people, they felt 90% better in 2 weeks. Some people feel 60% better in 3 months, right? So it'll vary. My criteria is this. If you're not feeling noticeably better in 6 to 8 weeks, I either need to change the supplement, change the protocol, do more testing. Because I have a pretty high bar. And that is, you should be feeling better, noticeably better in 6 to 8 weeks. So if you're not, I need to reevaluate something that's going on. It blows my mind that I have patients that say, yeah, I've been with the same doctor for a year and a half and I still feel the same.
Yeah.
What? I would never tolerate that. for that longer period. Something is not right if you're going that long. So 6 to 8 weeks for me is my criteria.
Nice, nice. No, I agree. I agree. It's definitely one of those things where if there hasn't been any improvement, I mean, granted, there are cases where it'll be slow, but there'll be something within that time. But yes, if there's no change, it's definitely, and folks who are listening, you guys know I say this over and over again, you got to advocate for yourself. If things are not feeling better in that time frame, you know, just like Dr. Kajiki said, you got to really be like, I got to find somebody else. I got to go to another program. And then you also have to do a little bit of your accountability on yourself and be like, am I doing what I need to do? Because there is that side of it too.
Right. And that's part of my accountability is I meet with people every 2 weeks. So I don't have more than a 2-week problem because I jump on it, right? If that 2-week period comes by and they say, yeah, I got worse, or I'm feeling worse, or something's not going right, I fix it right there. I don't go 3 months before I talk to them again. So I've got a 2-week problem on my hand, not a 3-month problem on my hand.
Yeah. Yep. A lot better for us to manage too in that department. Awesome. Awesome. And so in the scheme of things with your program, are folks, you know, I'm guessing there's some dietary work as a foundation. I'm guessing there's some stress management work as a foundation. And I know that everyone's going to ask me, you know, about, because there's a whole concept of gluten-free, dairy-free, all those different things. What's the philosophy on your dietary changes for folks?
So dietary changes is this. I do something called a de-inflammatory eating plan. It's not a diet. It's not a lifestyle change. It's temporary. I want to cut out the foods that are likely causing inflammation, because that's typically the big player in the game is inflammation.
Right.
And yes, it's things like gluten, dairy, soy, yeast, eggs, grains, nightshades, things like that. Those are the big guys that are causing inflammation. So with my eating plan, it's more about what you don't eat, not what you do eat.
Okay.
There's nothing magical about broccoli or carrots or cucumbers, but there is something magical about staying away from gluten. And gluten to Hashimoto's is like jet fuel on fire. Wow. There is no nutritional value in gluten at all. Zero, none. So why even have it? Why even take a chance on it? So I take out these typical inflammatory foods, and then I give very powerful anti-inflammatory supplements. And between those two things alone and some guidelines that I have them follow, it's a very effective protocol. Most people feel some kind of noticeable change in 2 weeks.
Nice. Yeah. I mean, the foods out there, definitely we have a plethora of inflammatory foods here in the US in particular. I mean, everywhere, but really pushed heavily here in the US. And gluten is, as I found too, just a big bugger there as well. And dairy seems to follow suit in that department. Now, what about stress? What's your approach with stress with folks? How do you tackle it? What do you kind of recommend in a general sense?
Gosh, stress is a tough one, because we all perceive stress differently, and we all react to stress differently. And when we start having these heart-to-heart discussions about stress, it's really about your reaction to the stress and your perception of the stress. I can help you with the physiological damaging effects that stress does to your body. So I can give you adrenal support, and I can give you leaky gut compounds that are damaging those body dysfunctions. But it's really up to you to determine how you're going to perceive that stress and how you're going to react to it. And really, that's the most controlling factor you have over stress. And there are professionals out there that can help you with that. I mean, there's meditation and yoga. That's more like filling up your stress tank and releasing it. Right? How you perceive the stress and how you react to it is more like a shield. It's more like deflecting it, so you don't have to fill up that bucket and re-empty it again. So, I mean, my approach to stress there is like, I'll help you with your adrenal gland dysfunction. I'll help you with how your brain talks to your adrenal glands, but you have to recognize your perception and your reaction to the stress.
Mm-hmm. Mm-hmm. Yeah. Ultimately, there's no magic pill, as much as many people would wish that there was. We
Yeah.
can't make it go away. And a lot of folks, unfortunately, kind of look at the adrenal supplements as being that magic pill to help the body to counter stress. And sadly, it just, I'm sure you've noticed the same, doesn't do the same thing.
Right. Right.
Oh, man. With the thyroid conditions, it is, an undertaking, and it's good to see folks like you coming out and really helping folks to really get the answers they need, but also get their life back, because this is part of the biggest factor here. You say it in your book, The Sick, Tired, Untreated, and Abandoned: How the Medical Community Fails Hashimoto's Patients, and how you can get your life back. I mean, just right there. That is it. So, Dr. Kajiki, before we finalize everything here today, I'd really like for you to give folks one nugget that they can tie themselves to jump into your book and start to interact with you, to start working on getting their health back. What would you say?
One nugget.
You could do 5 if you want. It's up to you. A few.
Well, okay. So one thing is this: figure out what's wrong before you expect what to do about it. I get so many people saying, what do I eat? What supplement do I take? What do I do? And my answer frustrates them, because I say, I don't know. Because unless I know what's wrong, unless I know what triggers you have, unless I know what your symptoms are, I don't know what tests to start with. I don't know what supplement to give you. I don't know what kind of diet to give you. I don't know what kind of lifestyle changes to. So focus on what could be wrong that's causing my symptoms before you try to get into what do I do about it.
Mm-hmm.
And my book is totally about how do I figure out what's wrong. Look at the triggers, match your symptoms to what triggers you have. And then once you kind of have an idea what triggers you have, you do some testing that would confirm or deny what, if that trigger is an issue or not. And then once you figured out the trigger that you have, now you could start creating natural protocols with vitamins and herbs and minerals, enzymes, amino acids, detoxes, de-inflammatory eating plans, lifestyle changes that could start resolving those triggers. And yeah, that's a lot of work to do on your own. And it's probably near impossible to figure out what trigger is highest priority. But if you're a do-it-yourself person, that's where you can start.
Mm-hmm. Mm-hmm. No, I mean, that's what I like about your book, is because you've got that basis of looking at the triggers. Because so many people will come to me, same thing, like, doc, what do I eat? What supplements do I take? And my answer is the same. I don't know, because I don't know what's provoking, what's the underlying thing. I mean, I can always blame it on stress, but there's sometimes, what did the stress fuel? Like you were saying, infections, things of that nature. So I love that you're bringing awareness to the idea of, well, what triggers, what makes your symptoms worse? Do you have a survey or a journal? Do you sometimes have people do journaling to figure out what the triggers may be, to help them kind of assess a little more?
Yeah, I mean, I do have people journal, but most of the times when I give them my eating plan, it's very specific. And do you need to follow it 100%? Yeah. If you expect to get good results, yeah. If you follow it 90%, will you get 90% results? Maybe not. So it's when they follow it 100% and they're not getting the results we're looking for, then I'll say, all right, you need to do a journal. Tell me exactly what you put in your mouth every single day. And then what they're finding is they thought a little tiny cheat isn't that big a deal because it really didn't bother them before. But then we kind of troubleshoot it that way. And we go, okay, well, that's why. When are you going to bed at night? What are you doing before you go to bed? What kind of stress management do you? So those kinds of journals, I have them do if my protocols aren't working the way I expect them to.
Makes sense. Makes sense. All right, folks, you've heard it here. You got to be on it if you're going to be working with Dr. Gill. And honestly, I mean, if you want your results, you have to be pretty strict in this case, because ultimately to get better, you've got to put in the work. That is the bottom line. Absolutely. Yeah. So Dr. Gill, we can find you over at valleythyroidinstitute.com. And your book, of course, is Sick, Tired, Untreated, and Abandoned: How the Medical Community Fails Hashimoto's Patients and How You Can Get Your Life Back. Now, can folks find your book on Amazon? Where's the book found? Where do we get it?
Yeah, you could find it on Amazon by doing a search under Kajiki Hashimoto's. Probably the best place to go is I have an alternative website called drkajiki.com.
Okay.
That's drkajiki.com. If you go to that site, I've got these free thyroid videos that you can download. We talk in detail about the triggers. Mm-hmm. And we talk about what to do when the medications don't work. You can purchase some online videos where I go into a complete thyroid presentation. I've got a PowerPoint presentation. I go into this complete presentation on thyroid dysfunction and Hashimoto's and the triggers and the testing. And I've got the book that you can purchase. There's a link on there, takes you straight to the Amazon site. And if you just want to get down to it and you're just sick of it, just say, you can purchase a $97 30-minute consultation and just talk to me. This is where you could say, where do I start? What's the next step? And you can just bypass all the other do-it-yourself stuff.
Nice. I like that. Yeah, sometimes it's just a matter of help now.
Yeah. I've done it all. I've got every book. I've done every diet. I've tried every supplement. Still not working. Right? There's something going on, right? Your lab test cannot be normal and you still feel lousy. So somebody's missing something.
Absolutely. So folks, I'm going to have everything over at drjkrausend.com. You can find all the details, all the websites that we've mentioned, and all of those details on how you can chat with Dr. Kajiki to learn more about what the heck is going on with your condition. Dr. Kajiki, thank you so much for coming on and sharing all the information about your book, your Thyroid Institute, and just all the good nuggets. I think folks are going to get a lot out of this. I appreciate it.
Thank you so much. This was a very productive 30 minutes for people, I think.
Good. I think so too. Hey, fellow health junkie. Thanks for listening to the Health Fix podcast. If you enjoyed tuning in, please help support me to get the word out about the podcast. Subscribe, rate, and review, and just get that word out. Thanks again for listening.